Okay, great. So recording is going. So I guess I already said this, but I'll say it again for those that are watching the recording. The goal behind today's office hours is to walk you all through some tools and resources that the EPI team, that Krissa, Latoya, Kaylin, myself, the team that's worked with you all for a couple of years now. We've developed these tools to, support you as our team's capacity gets scaled back, as some of our team members move on to permanent positions outside of the COVID response. So we understand that folks on the call, folks listening in, might be in different places in terms of your comfort with responding to individual levels of cases. We know there's some of you out there that, feel very confident in what you need to do when a staff or child tests positive. And we know there are some of you out there that are still, developing that confidence on your individual response. So with that said, we do expect that some folks are going to need a little bit more time, a little bit more correspondence back and forth with our team, whereas others might see these tools and be ready to take off and use them as soon as they're, in your possession via email. So that's kind of just my quick disclaimer, is that we're not cutting anyone off. We're not saying that you can't contact Healthy CE when you have cases. We're just going to be kind of shifting it more. So when you contact us, we're going to be helping you use these resources and tools to figure out your next steps on your own. So, okay, let's go ahead and kind of dive into it. I'm going to share my screen, and then I'm going to ask for a quick confirmation that that worked. Let's see. Can folks see a Word document on the screen at the moment?
Yes, we can.
Great, thank you. Okay, so what we're envisioning is that in the weeks to come, hopefully we can get the Child Health Promotion team and communications and our EC EPI team in a conversation, because I'd really love to have this information in one place on a BCPH webpage where you all can go to get these tools and resources. Admittedly, that will probably take a little bit of time, just because there's quite a few approvals that need to take place before something gets posted on the website. But I do think that it's probably fair to ask Jane to send these resources out to you all before it's on the website, and we might just have to put like a draft stamp on the document. But the goal is that hopefully we can get these to you maybe as soon as the end of today, and that they will live more long-term on a yet-to-be-updated webpage. So with that said, I'm just going to give you kind of a high-level overview of these resources that we're providing. And then I'm going to actually walk you through 2 Excel workbooks that we think will be really helpful resources for you to figure out exclusion and return timelines independently. So the way that we're kind of breaking this down, and again, this absolutely might change, especially when we work with communications, but currently we have it laid out or working that it's going to be kind of a step-by-step, really simplified, concise list of what to do when a staff member or child tests positive. Now, previously, as you all know, we've had you all reporting individual cases to us over the last couple of years, even if they weren't present while infectious. While that still remains a state statute, the reality is that as public health teams get scaled back to a volume that was, a staffing volume that was more typical pre-COVID, the capacity really isn't there to do individual level follow-up. And really the key pieces, or the most important things when someone tests positive, is making sure that we're keeping them out of care and know when they can return. So we're developing these tools and resources so that you can figure out what steps you need to take without necessarily reporting every individual case to public health. So we'll do a much deeper dive into that in a couple minutes. But that's really going to be the first place to start, is giving you a place to document your cases internally, which will fulfill your reporting requirements without actually having to email us every time you have a case. And then we're going to provide some language around how to figure out if this individual, the staff or child, was actually contagious while they were at your facility. And I think that's helpful to break it down to kind of two parts. Were they contagious while they were there? And if so, were other people exposed? So with that second step, if someone wasn't even contagious while at your facility, then there's very minimal follow-up that you would need to do. So we're just going to walk you through how to determine if that person was contagious or not. And then we have it broken down to a third step. So if you determined that person was there while contagious, what do you need to do? And it gives you just very high level, these are the folks that most likely were exposed if they had certain interactions with this person. And so that step kind of helps you figure out, okay, who may have been exposed. And then we've got a fourth step, which is notifications. So as you all know, one of the big roles that we've played is distributing exposure notification letters or providing you all with exposure notification letters for you all to distribute to close contacts on public health's behalf. So we're going to continue to do that. Public health notifications are a really critical piece to let people know if they've been exposed to an infectious disease and what they should look for, when they should get tested. So we definitely want to keep those letters up. But since we are no longer requiring you to report anytime there's just an individual isolated case to us, we're actually going to try to make those letters available on the website. They will be undated. They're not going to have your facility name, but they're going to be essentially the letters we have supplied you in the past. So that's what step 4 is. If you get this far, so you've got a case, you figure out they were there while contagious, and you figure out who may have been exposed. Step 4 is deciding which letter to send, and we've broken that down for you as well. So I know I'm kind of scrolling. You haven't, been able to have an opportunity to really read these quite yet, but I really just wanted to, again, at a high level, show how we're really breaking down these major steps when you find out about a case in your facility and what you can do without working with us. Now, you will absolutely be reporting clusters and outbreaks to public health still, and we will certainly be working with those with you on those. And we have included language within these tools and resources to make it very clear when things need to be reported and when they don't need to be reported. We can certainly talk about that a little later on, but I just wanted to just to clarify, when I say you don't need to report to individual cases, it doesn't mean we're not working with you for clusters and outbreaks. We're just talking about, a one-off case that does not appear to have spread throughout, your program. Okay, likewise, we're going to have ideally, we're going to have a section about what to do when someone attending your program or working at your program lives with someone who has COVID-19. We're keeping the language very clear and concise as well. Here's the conditions that can allow someone to continue coming to care or work, even though they live with someone. And if someone doesn't meet those conditions, we are providing you with a calculator tool to figure out when the earliest dates that they could return. And then finally, we're going to have this large section on guidance and resources. So the team has been busy gathering and organizing links to external data sources, Boulder County data sources, CDC, CDPHE guidance. So really a lot of the guidance that has been distributed, over the past couple years and updated, but we just want to have all those links for you in one place. So that was some feedback that we got from the survey, and we're really trying to make sure that we address all the feedback with our tools and resources and links. So the guidance and resources will be grouped by general category, data and community levels, general ECE guidance. As well, we'll have a little section for camp guidance, as well as the non-COVID routine infectious disease resources that you all as childcare providers should be familiar with. So your how sick is too sick, cleaning and disinfection and ventilation guidance, vaccine information, which is very timely given the recent approvals, testing information, and the infectious disease manual. So again, we're trying really hard to just really have kind of a centralized web page for you all that has instructions on what to do in certain situations. It has links to tools and resources to help you respond in those situations, and then it has a bunch of links to guidance and other related areas that you might need to refer to. Now, before I get into it and show you, oh, and I should mention, for the resources and the letters, we do have Spanish versions available. So as long as the Spanish version of our exposure letters, or I'm sorry, as long as so our exposure letters we have in Spanish, and then as long as these web pages have a Spanish translation, we are also including a link to the Spanish version as well. So trying to cover all the bases. But what I was saying was, before we dive into two of those tools that I think will be the most helpful to you all, does anyone have any kind of high-level questions about this transition? I'll also take a peek at the chat and see if there's anything in here. Okay. Not seeing anything in the chat, and I'm not seeing any hands or folks coming off mute. So I'll go ahead then and get started by sharing the first tool. So this is a tool that folks will be able to use, or I'm sorry, not would be able to, should be prepared to use when you find out a staff member or child tests positive for COVID-19. And this is our COVID-19 tracking workbook. Okay. So when you open both this workbook and the next one, which has to do with quarantine, you will have tabs at the bottom. One will be an instructions tab, and one will be the tab for you to actually use the tool. So for the case tracking workbook, the intent behind this is to have a place for you all to track your COVID-19 cases over time without sending individual emails to us. Again, I'm going to say this like 20 times in 20 different ways because it's such a massive shift in what we've been doing. But you will know, I mean, effective as soon as you have this workbook, you do not need to email Healthy CE whenever staff or child tests positive. Instead, the expectation will be that you document that individual in this workbook, and you continue to do this independently. Now, what it says here in the instructions is when to contact us. So really what we're trying to get at here is kind of a range of public health concerns, right? So you may have an individual with COVID-19, and this is where we're trying to empower you to respond to that one individual without needing support from a specialized team. Where our specialized team or generalist epidemiologist, whatever contact we have for you once people's positions are finalized, that will be your point of contact for once you start seeing or suspecting multiple individuals who have signs and symptoms of COVID who have tested positive. So in this instructions, what we say is you must contact Boulder County Public Health and submit your copy of this workbook when you have 5 or more unrelated staff or children with COVID-19 within 2 weeks. By unrelated, we just actually mean residing in separate households. So we'll go ahead and make that a little bit more clear with the wording. Oh, and I should say, please, please, please unmute yourself if you have any questions as I walk through this. This is very much still supposed to be like an informal session, and it's very helpful for our team to hear questions, or if you're feeling confused, it's really helpful for you to speak up because chances are someone else is probably thinking the same thing, and it's only going to help our team improve these tools better before we send them out to you all. And since I'm sharing my screen, I can't see if anyone raises their hand or puts something in the chat. So I said, feel free to just unmute. All right, back on track. So unrelated, we're talking about separate households. And the 2 weeks is just the reasonable period of that if we're seeing multiple cases in a facility within 2 weeks, there is a chance that there has been some spread, and that's something that we want to investigate. So that is the must. When you have 5 or more unrelated staff, that very well might be an outbreak, and we absolutely need you to report that. However, as a lot of you know, by the time you have an outbreak in your facility, it can be really tricky to stop the spread, because at that point, exposures have already happened, right? We're just finding out about people are positive, they've already been infected. So because of that, we also have a second one to contact BCPH. Note the wording is strongly encouraged, not must, but folks are strongly encouraged to contact Boulder County Public Health and submit this workbook when you have multiple individuals with positive COVID tests in the same classroom or multiple positives among staff. So here we're really just saying, look, we really, really want you to reach out with us before you hit 5 or more unrelated staff, but it's not something that you are required by state statute to do. I'm going to take a pause. Any questions on the instructions before we walk through how to actually use this tool?
I have a quick question.
Yeah, absolutely. Thank you.
So when we had talked to the health department previously about what is considered an outbreak, there was a lot of criteria or a cluster. And one of the criteria was that the testing was done with PCR and not necessarily an at-home test. So when we're considering positive cases in a classroom, is this the result of any testing, of any COVID testing that's available that the parents have access to, or is it still the PCR testing that you're looking for to consider it an actual positive to be a part of a outbreak or a cluster?
Absolutely. So that's an excellent question, Amanda. This is kind of one of the things that I've struggled with a bit. Is you have all done a phenomenal job at learning so much about public health through the pandemic, but then there are still some really nuanced gray areas that even public health doesn't always get straight, consistent answers on. And outbreak definitions are kind of one of those things. So that 5 or more unrelated households with onset within 14 days, technically for that to be considered a confirmed outbreak, certain conditions about testing and symptoms do need to be met. But that is all pertaining to outbreak reporting. So I would say we really should be conceptualizing outbreaks with kind of 2 big categories of response. So the first one is disease control, and that's always the most important. That's intervening and trying to stop the spread so additional people don't become infected. And then there's kind of the second half to outbreaks, which is reporting, which is a lot of state statutes and us reporting if facilities have an outbreak. So with that first part, disease control, if you have 5 or more cases that all have at-home tests, we are very confident that that is indicative that there has been spread and we need to intervene for disease. We might be treating this like an outbreak. However, on the reporting end, the definitions have changed so much over the last couple of years and require so much documentation beyond what facilities can and should be doing themselves that ultimately we would prefer that Boulder County just makes that final call if it's an outbreak or not, because we're going to have to do really deep dives into like laboratory laboratory results, clinical records, etc. So to try to kind of restate this in a more concise way, we are more concerned with the disease control side. We are more concerned with you all reaching out when you see multiple cases and we can see early on what the situation is. The reporting side, some of those situations will get counted as confirmed outbreaks and reported to the state. Some of those situations won't get reported to the state. But on the front end, our disease control response is going to stay the same. So all I'm trying to really urge here is reassurance that the outbreak definition is something that's very, 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 very difficult, if not just, it doesn't make sense for our external partners to try to figure out if they meet the confirmed outbreak definition or not. because you're going to need more information than you have at hand. And like I said, it doesn't change the course for you at all. At all. We're still going to respond with disease control the same way. It's really just a back-end requirement of whether the state counts it in their data or not. So that was a very long-winded response, but I hope that provides a little bit of clarity on why I'm essentially saying it doesn't really matter the nuances of how they test positive. We really just need you all to be tracking any positives, and we're going to start with disease control, and then eventually we'll get to the outbreak reporting section, and we'll figure out if it's reportable to the state or not. But that's really kind of a low urgency, low priority conversation compared to what is urgent, and that's stopping the spread. So in short, anyone with a positive test will get added to this case log, regardless if it's at home, if it's a PCR, molecular, and we'll just work with you moving forward to give you a heads up if it gets reported to the state or not. Amanda, do you feel like you got enough or maybe too much of a response there? Do you feel like did I communicate that effectively? That's what I'm trying to ask.
Yes, absolutely. I guess I should have just asked the question, do we encourage PCR testing, or do we just take people's antigen positive for a case? And I hear you, and I hear that we do not have to ask for additional testing if they test positive with antigen. We're going to consider them positive for COVID and document it in our, in our tracker.
Absolutely, absolutely, yes. So that you are 100% correct. If someone is positive on an at-home test, a lab test, community test, no matter what it is, as long as it's a diagnostic test, we'll treat them as positive, and they will get entered into this case report. I won't spend too much time on this, but just as one more clarifying point, that's kind of why the outbreak definition has gotten so messy at the state level, is that it doesn't include folks who test positive on antigen. And so that's why we're seeing this discrepancy where you might have preschool A and B who both have 5+ cases positive on antigen tests, both from an epi perspective seem to be like outbreaks, but the state might only count one in their data because of the type of tests that the individuals used, even though the BCPH disease control response is going to be the same in either situation. So yeah, the at-home antigen tests have definitely thrown a huge confusing wrench into this outbreak threshold definition criteria situation. But in terms of the response, any positive is a positive, and we're going to track and treat the same way. Great question. Any other questions before we dive more into the tool? Okay. So this tool, again, we really hope it will be useful for you. And certainly please shout out or put in the chat any feedback about certain columns, but I'll just kind of quickly walk through them just to see if anyone has any immediate questions. But essentially what this is what we're calling a line list. And it's literally a list of folks, line by line, who test positive for COVID-19. And again, I will add instructions. I'll add to the instructions to make it clear that it's for anyone with positive test. Okay, so I have two examples here in red, and then the idea is that you'll just create a new line for every individual who tests positive moving forward. And this can just be a running workbook. So you don't need to necessarily do a new one each month or each week. This can just be a running workbook over time. So when you've got someone who tests positive, you'll open up this workbook. And a lot of the fields in here are similar things that we asked when we were having you do case reports or when we were having you email us. We've really tried to narrow it down to the bare critical information that an epidemiologist might need to know if we start seeing multiple cases, and we've got to take a look at this and see if we need to investigate a possible outbreak. So start with, first and last name, date of birth. And date of birth is important. We sometimes have questions about it. That's important because we need to cross-check some different state databases for clinical and testing information. And so we do need first, last name, and date of birth to help verify that we're looking at the records for the correct person. Classroom group. So if you are a large enough facility and you have classrooms and cohorts, you'll go ahead, just, put some kind of nomenclature in there to, whether that's like a name, like the aardvark class, or it's a descriptor like toddlers, 1 to 2, whatever makes sense, go ahead and put it in there. It is helpful for us to know if this is a staff member or a student. You know what, let me actually do a live example as we're doing this. Let's say we have Chris James, who is a staff member. They're born 1980. So we just found out Chris tested positive. But this is someone who's a designated floater. So I'll just put floater as their classroom or group. Said their staff. And then again, floater, breaker, whatever language you use. Because again, this should really be a tool to help you all. So whatever is going to make the most sense for you to help kind of keep track of things, that's how you should enter information for sure. We do want to know, if known, did this person have an exposure outside of childcare? So it turns out that Chris, through your conversation with him, you find out that they have a partner at home who tested positive before Chris did. So I would say yes. If they, if you don't have those conversations, you can always put unknown, but it's good just to at least have record. If we do say yes for non-Ece exposure, we would like just some minimum information under our notes column, which is the end. So I would say partner tested positive on 6/5/22. Okay, so going back to Chris, so we know they had an exposure at home, the last date in attendance, so the last day they worked, let's say, sorry, I'm doing this on the fly, I want to make sure my dates make sense, so 6/5. So let's say their last day in attendance was the 7th, which is when they found out their partner tested positive. And then this individual, Chris, developed their symptoms a couple days later. So let's say they developed symptoms on the 10th. Now this column right here, onset date, is very, very important because we've included formulas within here. So it serves as a calculator for you. So I'll show you what just happened in a bit, but just know that this is going to be a really critical column to make sure that you guys do find out when their symptoms started, or if this was a person who never had symptoms, what was their test collection date? So we'll look at the calculation at the end. That's one of the last steps. So going back to the case details, if Chris never had symptoms, I would have wrote no symptoms, which we know to be asymptomatic cases. But in this make-believe example, let's say that Chris felt feverish, had fatigue, a headache, and a sore throat. So I'm just going to write, to the best of my ability, what I know about Chris's symptoms. Okay, so now we get to a testing section, and here's where you get to tell us about what kind of tests they did. So tested for COVID-19, the answer is going to be pretty much yes for everyone, because that is what we're tracking here, is folks that have tested positive. Make sure my timeline is making sense for this fake scenario. Onset date, yep. So let's say Chris got tested on the 11th. You can choose, if you know, was it a PCR test? Was it an antigen test? If you don't know, you can always press do unknown. Other tends to be Q, which is the CUE test, the molecular test. But again, we're really just asking you to try to complete this to the best of your ability. And then the result. So detected, not detected. So detected would be positive, not detected is negative. Some different labs use different language for those. Or pending. Again, yeah, we left pending in here as an option, but this is really supposed to be for folks that have tested positive. But if you wanted to put someone in there who's pending test results because you want to track it and make sure that you're staying organized with it, you can do that as well. Okay. All right. And so the testing section is really the last one. We've got notes, and really I would say, the more that you can provide in the notes, the better. And this is because, again, this tool is really serving two purposes, right? It's to help you all track your cases and to know when to reach out to us. So if these are all individual cases, there's no spread, we might never have conversations about Chris, James, and whatever other individual cases are in here. We might not need to know information from their notes. But if after Chris, you've got 2 more staff that are positive, and then you've got a kiddo that's positive, then at that time, we're going to probably come back, hop on the phone with you all, and talk about the cases and talk about, where they've been, what kind of what classrooms they've been working in. And so retrospectively, it might be really important to know this information, even if we're not sure at the time if we'll need to do any follow-up. Is that making sense? I'm trying to say, like, basically for this one, for Chris, knowing that he's a floater, I would say, I would like to know that they braked Todd's A and Todd's B classes while infectious. I think that's good to know again at a later date if we do have to do an outbreak investigation. Okay, so earlier I said that column H, onset date, is very important. And that's because I have formulas embedded in here to actually calculate return dates for you all. One second.
But your collection date is year 2012 versus
That
2020.
does matter. Oh, for collection date. Oh, okay. Thank you. Good eye. Okay. 1 second. I've got some protections in the. 1 second. Okay, cool. I'll figure that out another time. I was going to try to hide a couple columns so you could see the calculation actually take place, but I'm just going to have to scroll. So apologize in advance if I make anyone dizzy. So again, the onset date, once you enter that, it will automatically populate 2 potential dates for your staff member Chris's return. So as always, to return, they need to be fever-free for 24 hours without the use of medication. Other symptoms have improved. And then as we've discussed, per the CDC and CDPHE guidance, they can return after 5 days if they're able to wear a mask when around others. If they aren't willing or able to wear a mask around others, they should really be out for the full 10 days. So with Chris having an onset of June 10th, that automatically calculates their day 6 to be June 16th, or their day 11 to be June 21st. So I would look at this. If Chris is willing and able to wear a mask while indoors around others, then I would say, okay, the earliest Chris can come back is the 16th, as long as they're fever-free, other symptoms are improved. If they're not willing to wear a mask while inside around others, then I know that the 21st might be the earliest day they can return. I might still try to play around with formatting, but you might see these 1900 dates here. Those are just placeholders because I have the formulas built in, and they don't get calculated into current dates until you put something in the onset date column. It's just so you can see what I mean. So let's say we were entering a second person in here, named Lucia. So you'll see for Lucia, I'm sorry, I'm trying so hard to select cells and it's all protected right now. So that's why I'm scrolling around it with the cursor. It's literally the only thing I can change at the moment. But yeah, so for Lucia, you can see that the dates are still in the 1900s. But once I'm entering Lucia's information and I've got her onset date, let's say this is one we found out about this morning. Positive staff member, then you'll see that that automatically adjusted the dates for Lucia for someone who's tested positive today can return as early as the 28th if they're masking, or July 3rd if they're unmasking. So this is really it. Again, it's day to day. It should be a tool for you all. But then again, this may be a tool if we end up with an outbreak and we need to go back and look at your documentation to try to figure out what happened. I will say it's really important to note, I have this in the instructions on the website or the webpage language, but we can add it in here as well. This list does not replace your requirement to maintain an illness log. So this is separate to the illness log that you should be still maintaining for your for licensing and regulations. Which is why we tried to keep this tracking workbook to the bare minimal information that's needed. We didn't want you having to take a bunch of time to put this information in both your illness log and the case tracking workbook. But this is kind of what we came up with. And at the end of the day, again, it's still going to be a lot quicker for you to fill out a line in this workbook than to collect info and send us a case report over email. So I don't think it should be that much of a burden to do this, as well as maintaining your routine illness logs, but we are open to feedback. I will take a pause before we move on. I'm going to take a look at the chat. Feel free to unmute, raise your hand if you have any questions about this case tracking workbook. Okay. Okay, Elsa, I see your question. Yes. So Elsa asked the non-ECE exposure column, which is this one right here. Elsa asked if that should be used for someone who only has an exposure before they became positive themselves. So from an epidemiological perspective, yes, 100% Elsa, that's exactly what we would be looking at too. But we know it doesn't always work out nicely that way. Sometimes you'll have a kiddo with congestion and runny nose, but they had a single negative antigen test. Then their parents might be positive 2 days later, and then maybe the kid is retested and is positive. It can be really hard to know if it's like a chicken and an egg situation, right? Did the kid infect the parents and have a false negative test, or did the parents infect the kid? So often it's really tough to know the chronological timeline of whether someone was exposed. So I would say that's where the notes come in. So I would say if you know someone in the household has tested positive, say yes, and then try to put whatever details you know in the notes. So maybe, and then that can be for the epidemiologist to kind of figure out, most likely was this person exposed elsewhere or not. I think that question though is enough to prompt me to maybe rework the language in cell F to be something like, have they been around someone who's positive for COVID within the last 14 days, something like that. So it's not putting it on your shoulders to try to figure out whether the exposure preceded Chris or Lucia from getting becoming infected. Does that make sense? Okay. I'm going to give it another minute or two. You know, we do have another workbook to walk through, but I really want to make sure that we're covering people's questions or feedback as it's coming up. Okay. Is anyone else seeing anything from this workbook that might be helpful for our team to consider or modify before we send it out to you all? Okay. All right, so I'm not hearing anything else. So let's go ahead and move on to the second tool that we will be sharing with you all. So our second tool comes into play when you are in a scenario where you have a staff member, child, who lives with somebody who tests positive for COVID-19. And you know what, I think I'm gonna actually see, this is actually very helpful to change out or to say out loud, because I'm just thinking of more things, small things that I want to change before we send it out to you all. I think for this section, we should really conceptualize it as someone who lives with a person with COVID-19, but it could also be applied in a scenario where someone has significant exposure outside of care. So we're talking about two kiddos that are best friends and spent an entire weekend together for a sleepover, and then go home on Sunday, then Sunday night, and one of the kids positive. So I'll modify this language a little bit to say if they live with them or have had close contact outside of a child care facility. Okay, great. So the instructions for this one, we already kind of went through it a little bit, but just to review. So the goal here, basically the action item for you all is when you know someone who lives at home or has exposure outside of childcare to a person with COVID-19, they will need to be excluded for quarantine period unless, you know, they've tested positive within the last 90 days or are up to date with their COVID-19 vaccinations. If neither of those apply, meaning that they are not quarantine exempt and do need to be excluded, then we have a quarantine calculator for you all to determine the earliest day they can return to care. So this is a separate workbook from the one I just showed you. And we kept this as a separate workbook because a lot of the feedback on the survey, as well as just our, you know, correspondences with you all over time, have suggested that determining when people can return after household quarantines can be one of the trickier ones compared to determining when someone who's positive can return. So we really tried to make this, again, we try to strike that balance between concise and comprehensive. So hopefully we hit the mark here. But again, when you open this workbook, you'll have two tabs. You'll have instructions and the calculator. For the instructions tab, kind of repeat the things I already just said, figuring out if someone needs to be excluded for quarantine or not. And just like cases, you do not need to notify us when someone is a close contact. If you do moving forward, in fact, we're just going to walk you back with this calculator and say, let's walk through this Excel calculator together. But really, yes, in addition to not reporting cases, you do not need to report close contacts to us moving forward. And you do not need to record close contacts in the case tracking workbook unless they test positive themselves or develop symptoms, they're pending a test, that kind of thing. So what is a little different between the calculators is the one for positives is both tracking cases and doing a calculation, where the quarantine one is just a calculator. We really don't need you to track it for our benefit. Of course, if you need to do something internally, I mean, do what you need to do, but we don't need you to track contacts for us. So we have two quarantine calculators in here, and in the instructions, we explain why we have two. So this has absolutely been one of the more confusing things to try to work through with folks, and I'm sure most of you on the call can sympathize with that. There's really two different ways we would calculate when someone's going to return from quarantine. I would say maybe 90% of the time, it's going to fall under what we're calling scenario one. So scenario one is you've got a child or staff who has someone at home with COVID-19, and they're going to continue to be around that person. So what we're talking about here is, remember, if it's a positive parent or guardian, a positive sibling, that positive individual is going to be most infectious for 5 days. And so we have to wait for day 6 to start quarantine for the healthy contacts in the household. So we've done kind of multi-step formulas for you, so you don't need to calculate anything other than just enter a date. So for scenario one, which is going to be, again, the vast majority of household situations, Pretty much if the positive parent, child, etc., is staying in the household, we're going to call that ongoing exposure. So even if they're staying in their bedroom, most of the time, if they're still using the same bathroom as our healthy contacts, or still using the same kitchen as our healthy contacts, that can still be a route of exposure. So that's why in that situation, their quarantine is going to be calculated from the end of this person's first 5 infectious days. And then the second situation, scenario 2, we don't see it that frequently, but it does come up in some situations where, a family might have the resources to send the positive parent to a secondary house, a vacation home, a motel, the mother-in-law cottage on the property. As long as that positive case does not have further contact with your healthy child or staff, and they're not using the shared spaces, when that situation does arise, which again isn't often, you can use scenario 2, which is going to calculate return from quarantine from their last date of exposure. So we have that kind of laid out here in the instructions. Again, I say most situations are going to warrant the use of scenario 1. So if you're using scenario 1, all you need to find out from the family is what date did the COVID positive household member or close contact start symptoms, or what was their test date if they never had symptoms. And that will automatically calculate the earliest return for the contact. Got to clarify. So let's say this is, you've got a staff member who is not up to date on their vaccinations, and unfortunately their household or their partner who lives in the same household is just tested positive today. All we need to know from that staff member is the positive person, what day did their symptoms start? So if we find out that's June 20th, then again, that will automatically calculate the end of quarantine for a person after that household member is no longer infectious. So this is going to be a longer period than the one below in most situations. Let's say that this staff member with the positive partner is one of those few folks that has the kind of resources to, let's say their partner is going to stay in a motel. So we don't need to wait for that person to be done with their infectious period, because your staff member, in theory, is not going to be re-exposed to her partner who's staying at the hotel. So in that case, we're going to just use the most recent date. So let's say the partner found out they were positive today and left for the hotel today. So then if we were using scenario 2, we would just put today's date, just the last date that your staff member had contact with their positive partner before they left the house for isolation. And you can see that's a little bit shorter because we're not waiting for them to complete isolation first. I promise it's not as confusing as this explanation is probably making it out to be. I think the main thing for you to understand is that for a staff or child, you're going to be following one of these scenarios. It might be helpful. Like, for example, if you're having a conversation with the parent and they're like, I don't know, like, the other positive parent and child, they might be able to separate in a basement suite. Well, we can use this calculator, find out what the return dates would be in either situation, whether or not there's ongoing exposures until the people are no longer contagious. But at the end, you will just use whatever scenario makes sense for that household. Okay, I'm doing so much talking. Do you all have questions or feedback on what you've seen so far for the quarantine calculator? Okay, I see a comment in the chat from Abby about vaccination communications. We can also, let's see, Jane, if you're still on this, would you be willing to shoot a message to our vaccination team and see if they have any communications in the works?
Yep, I just did. I haven't heard back.
Woo, mind reader, thank you. Yeah, they tend to know, yeah. I tend to defer to official communications first. And if they aren't doing anything, we can see what we can do, like Kaylin said.
And she responded actually just now and said that they are working on it, should be on the website today, but she did say the website was updated.
Perfect. Great. Thank you so much. Okay, so Elsa has a question related to that. So any different quarantine guidelines for kids once fully vaxxed? Yeah, so that's what we're trying to kind of get at with the instructions in the quarantine calculator is under instructions. Or I'm sorry, before we even get to instructions, when to use this workbook. So we have this in, let's see, I'll try to zoom in. It says very clearly here, before proceeding, if either of these conditions apply, you do not need to exclude them for quarantine. So if they've tested positive within the last 90 days or are up to date. And we've included a link here to the CDC's webpage that specifies what up to date is. And that's why we really want to empower you all and your parents to know what up to date means for that given age. So if you follow that link to staying up to date with your COVID vaccines, it breaks it down by age. So if you're an adult, 18 or older, if you're a child or teen, 12 to 17, if you're a child age 11 years and under. And what it will do, you so let's say we've got a kiddo under 5 with the Moderna vaccine. Then it tells you exactly what needs to have happened for them to be considered up to date. 2 weeks after final dose in primary series, that will change once the booster is approved. So that's why we're deferring you all to really just bookmark this CDC resource and have the parents bookmark it too and know, because the definition of up to date does change when additional approvals happen. So for example, oh gosh, what was it? The 6 to 11-year-olds that recently had boosters approved, they were considered fully vaccinated just after completion of their primary series, right? But once the FDA approved a booster and the CDC recommended a booster for that age group, they no longer were up to date, you know, if I think 5 months had passed since the completion of the primary series. So that's why, in short, to know if a staff member or child is up to date, you or them should check this website, figure out which category they fall under, and then follow the definition based on which manufacturer they received. So I'll just show you a different one. So adults age 18 and older. So a staff who got Pfizer, it says you're fully vaccinated if you're 2 weeks after final dose, but up to date is immediately after getting all boosters that are recommended as written here. Okay. So like I said, we're trying really hard to think about whatever questions might come up and give you resources and links for them. Aside from the up-to-date one, are there any other places that people are, yeah, exactly, Elsa, boy. Yeah. When we link out to an external resource, it's because there isn't a simple way to include it in our tool without also making it subject to being outdated. But anything else that you all are seeing? Yep. Okay. Thank you, Andrea. Can you put calculator screen? Yes. Do you want the quarantine calculator or the case tracking workbook? I'm going to lean with quarantine calculator, and if that's not the case, just let me know. Again, the calculator for quarantine. There you go. Hopefully that zoomed in enough to be legible. And the other thing that we're doing, which is why I was getting tripped up with not being able to hide columns earlier, is my intent is to have this workbook locked when we distribute it, meaning that only the very specific cells that you should be using to enter something in will be the ones that you can modify. So in theory, if you've got a parent who is, not happy with the quarantine timelines, like theoretically, you could share this calculator with them so they could see things for themselves. So what I'm trying to say is there shouldn't be a way to either accidentally or intentionally modify formulas. It should be protected for any user who's using this. And the same would go for the tracking workbook. It should be locked, so only the cells that you should enter information in are selectable. Whereas things like the automatically calculated ones should be locked because it's preserving a formula that's embedded in there. Okay. So we are at time. I am happy to stay on though, because I know this is a lot. But I will kind of try to wrap this up with a couple takeaways before I stop the recording. So regarding this timeline, like we said, we're hopefully I can work with Jane and get these calculator tools and written instructions out to you by the end of today. It will be a little longer to get it on the website, but what you can do is you can start using the tools as soon as you receive them. You can stop reporting cases to us and stop reporting contacts. Again, we're not going to be upset if you do email us, but what we're going to do is we're going to just say, hey, let's look at this calculator. Let's walk through it together. But after this call, if we don't hear from you until you have a cluster or an outbreak, that's okay. As long as you're tracking the cases in the case tracking workbook, that's fulfilling your reporting responsibilities. And yeah, you can probably hear it in my voice. It's a really big change for us as it is for you all. We've been, doing reporting for the last 2 years. So I kind of feel like a parent who's like seeing their kid go off to college. I'm like, all right, you can do it on your own. I mean, you can still call us and we'll be there for you. But if you're feeling ready, we do want to encourage you to start using these tools as soon as you're ready. As you start using the tools, if you're running into questions, if you're not sure if you're doing it right, or if you just want to share it with us and say, am I documenting things correctly? We are happy to put eyes on it. So I do expect a lot of our email correspondence in the coming weeks to be supporting folks on the use of these tools and resources. And absolutely open to feedback. Like I said, these tools, we really want to work for you all. So once you get your hands on it and start playing around with it, if you're running into bugs or you're like, hey, this might be better worded a different way, please let us know and we'll see where we can make improvements where we can. Okay, I'm going to stop sharing my screen and I'm going to stop the recording, but I'm happy to stick around.